Who owns the dental record? Okay, this is the question. Who owns the dental record? The patient versus the dentist. Who owns the records? If you have an answer, you can shout it right now with me. However, I'm going to walk you through the whole thing with you, okay? I have found the evidence that supports whatever I said in StudentRDH. So let me flip the screen and show you all of that. So this is StudentRDH, and I quickly wanted to show you here that under HIPAA, it says that the patient owns the record and the patient has the right to request the dental records. That's it, right? So I wanted to just show you this, and I'm going to go to a different page over here that is called Dental Records. Again, this is in StudentRDH Dental Hygiene Exam Prep Solutions. And it says here, okay, I wanted you to scroll down. Okay, here, the dentist owns the physical records of the patient. Second to last bullet, it says dentist owns the physical record of the patient. This is the answer, okay? Patient versus dentist. Who owns the record? Dentist. Let me just show you the evidence here now. So as you can see, this document is called the dental record. Who is this from? Is this from the American Dental Association? You know, the authority that provides a lot of guidelines, who really just helps us dental professionals be compliant, and just lots of information on this website. So anyhow, I found this on the ADA website, and I'm just going to take you to page number 9, this part of ownership. So as you can see, there's a section that actually is called ownership. So I'm going to highlight some things as I talk over here. So very clearly it says the dentist owns the records. Yes, okay. He or she is the legal guardian. And patients do not have the right to own the records. However, they can see, view, inspect, request, obtain a copy of the record, okay? So again, the patient is not the owner, but they can say, hey, I want to see it. I want to make sure that everything is correct. Or, you know, I suspect there's some things, whatever. They can ask for a copy. So this is most important to know. But when the patient requests a copy, well, the dentist needs to provide them, and that includes radiograph. And it says, first of all, within a reasonable time frame and at a reasonable cost. So the cost can be something related to, let's say, administration fee. Let's say if it took your office manager 30 minutes, if the office manager is paid, let's say $40 an hour, then this is $20, for example. And on top of that, you can charge some things related to labor, copying, postages, and things like that. So you can understand that the dental records, when a patient requests them, you cannot, you can't charge them $500 for it. So basically, again, the patient can say, I want my records, and the dentist will have to give it to the patient, a copy of it, not the original, okay? Now, if the patient has, not paid the bills for the dental services he or she received, well, you still have to give them the copy, all right? So you just have to still release it, but you can charge a small fee again. Okay, so I want you to just really see this with your own eyes through the ADA guideline. Now let's continue just a little bit further, okay? So transfer or copies of records and release form. Why do we need those? Okay, why do we need to know about this? Well, patient can travel to different places, can move. Some other entities might request a patient's dental records as well. But you cannot just transfer the records. You need what is called an acknowledgement form, or something that is called an authorization form. And state by state, it varies. So make sure that you are compliant with your state's guidelines, okay? So you can't just send a copy somewhere else. You need some sort of form, okay? So you might have a form already that exists in your dental office that is compliant to your state's regulation. All right, so let's look at this thing called the release form. And again, is the patient saying that I am aware that the records are going to be released to another provider, for example? okay? Or vice versa. The patient might bring their actual medical history from another office to the dental office. So they probably done the same thing, signed the release form and authorization form, okay? So signing such form is generally not required by HIPAA to send records to another health professional. But in some states, consent is required before releasing. So again, this depends on the state, but generally you would need something that says the patient has authorized this. Let's just go one step deeper. Who can release consent to the release? Well, obviously the patient can consent, or legal guardian if the patient is a minor or needs some assistance. And well, in case of death, the administrator of the estate. So those people can ask for a transfer release. Okay, so I just wanted to share this information with you. Now, very lastly, this is what I want you to see. So general releases may not suffice for records containing HIV or other sensitive materials, meaning that if you said, okay, I'm going to release my medical forms or my dental records to this other office, that might not contain some really important information such as HIV, or they say other sensitive materials. Here, it says most states' law prohibit the disclosure of HIV status tests results to a third party without a specific written authorization by the patient or the patient's representative. Meaning that when you receive record, that record might not say the patient has HIV. So I just want you to be aware of that so you can dig a little deeper, okay? When you have a patient, don't just rely on, hey, this is the medical record, this is the dental record. You might actually have some investigation to do. Just ask the patient, hey, any change in your medical history? But don't just say that, okay? Saying, there might be information that I don't see here on my chart. Please be honest with me. We have to go very deep into this. I was in a CE course lecture recently, and the presenter was saying, she asked the patient, any changes in your medical history? The patient said no. However, the patient is now pregnant, so that's a big change. So they might actually hide a lot of information from you. So it's your job, it's our job to try our best to gather as much information as possible. But even if the patient has HIV, we know that the standard of care does not change. We are not going to refuse the patient. We are still going to use the same procedure. However, again, the records might not show that because it needs an extra step to release that kind of information. And it says here, even if appropriate authorization or consent is received, dentist or other healthcare professional may be legally precluded from releasing HIV/AIDS record without specific reference to that information in the release. Some states have heightened confidential provision for sensitive information. So when you also transfer the record, make sure that the patient agrees to release very sensitive information. Okay, so what we did today is just to overview what it means for the dental office to have ownership of the records, whether the patient can ask for a copy or not. We know the answer is yes, but the patient does not own the record. And when we transfer the copy, what we need, which is acknowledgement form or authorization form, and also some sort of release form. And again, though this depends on the states. And lastly, there are some information that might be missing because it takes an extra step to receive it or to send it somewhere else. Well, I hope this was helpful. I know this was a lot of information. And if you have questions, I'm going to send you the link. I'm going to put a link here about this ADA guideline. And also, if you want to take the dental hygiene boards and if you need something else to study, please go to StudentRDH.com. If you are in Canada, StudentRDH.ca. There is everything you need to know in that board's review course. All right, so keep following us. Please say subscribe here for the YouTube channel because I'm going to come up with many more videos that are going to be super useful to you. Okay, bye.